Okay, well, we are back here tonight to go ahead and work on the skeletal system. And just like always here, I'm just going to take a minute to set up my pointer so that you can actually see it. So again, we're going to be doing the skeletal system tonight, and I think that you'll find that now some of these lectures are going to get really interesting because now we're actually getting into the anatomy system. So we had started with the integumentary system, and now we're going to, from here on out, just be going through the different systems. So the skeletal system's a fun one to go through. So let's go ahead and get started here. So when we talk about the skeletal system, of course, we have to talk about bone, which is the main component of your skeletal system. And when we talk about bones, we're going to talk about the bones at the microscopic level and then kind of move on up from there. So when we talk about bones, bones are actually, bone is a tissue type, and bones are very, very active tissues. As you're going to find, bone is constantly being remodeled, meaning broken down, and then we rebuild that bone. So we'll talk about that tonight. Each bone, as we talk about them, is made up of several types of tissues. So when we can talk about bone tissue, but then we can also talk about, when we talk about bone, like your humerus or your radius, that bone is made up of bone tissue and other types of tissue like vascular tissue with the blood vessels. So when we talk about bone, bone is actually an organ. It consists of bone tissue, but it's actually an organ. And let's see, some functions of bone are going to include, of course, muscle attachment. It's the bone, again, makes up the major structural support for muscles to attach. It provides, obviously, again, support for the body as well as protection. So we'll talk about, again, the ribs provide protection for the thoracic cavity, or the lungs and the heart. So we'll talk a little bit about that tonight. We'll also talk about the fact that bone functions for blood cell production. So we'll talk about how that happens. And then we'll also talk about the fact that bone functions as a storage of minerals. And as you probably know, one of the main minerals that bone acts as a storage for is for calcium. So as you can see here in this lovely picture, bones differ in size and shape, yet they are similar in several ways. And we're going to talk about the ways in which they are different tonight, and we'll talk about the ways in which they're alike. Now, when we talk about bones in terms of their size, we'll talk about the fact that there are many different shapes and sizes of bones. And so we'll talk about, in terms of shapes, we'll talk about the fact that we have long bones. Oops, if I can get my pointer here. So we'll talk about the fact that we have long bones. We have short bone. So long bone would be something like, again, in this picture here, you can see like a humerus or a radius. We also have short bones. We'll talk about short bones would be something like your carpals or your tarsals as we get into that tonight. We also have flat bones. So flat bones would be like your scapula, and we'll talk about it, or your ribs actually end up being flat bones. We also have irregular bones. And irregular bones would be like the bones in your vertebra. They're an irregular shape. And then we have, as our fifth shape for bones, sesamoid bones. And sesamoid bones are kind of fun because these are bones that don't articulate with other bones. So, for example, your patella that makes up your kneecap is a sesamoid bone. So again, that just gives you an idea of some of the different shapes that bones will come in. And again, of course, they come in very different sizes as well. So now we're going to get into kind of talking about the anatomy of a bone as an organ. And so if you look at a bone as an organ, we're going to break this down into some of the major parts. And this is where it gets into a little bit more terminology. So when we look at something like the femur here, the femur, which would make up your thigh bone, we're going to see that we have the shaft of the femur, and the shaft is actually called the diaphysis. Okay, and then the ends of the femur here, or the ends of a long bone, are called the epiphyses. Okay, so the epiphyses. Now, if you look here, now that you know these terms, we've got the proximal epiphyse, which is going to be, again, proximal is closer to the trunk of the body. So that's the epiphyses that's closest to the trunk of the body. That's going to articulate again with the hip. And then here is the distal epiphyses, which again is going to eventually, here would be the knee joint. So again, that just gives you a little terminology in terms of how we break down your long bone. Now we can start to look at the difference between the epiphyses and the diaphysis. If you look at the epiphyses here, the epiphyses are going to contain what's called spongy bone. Okay, so it literally is just like it sounds, spongy bone that actually has air-filled spaces in it. And as we're going to talk about, that spongy bone actually contains red marrow. So in those, they look like air-filled spaces, but actually in those spaces, you'll find red marrow. Now, when we look at the diaphysis consists mostly of compact bone. And we'll talk about what compact bone versus spongy bone looks like in just a minute. And then if you look in the middle of this compact bone, there is going to be this cavity called the medullary cavity. And the medullary cavity is going to contain your yellow marrow, which is going to be mostly fat, as well as it's also going to contain blood vessels and nerves that run through the bone. So again, in this medullary cavity, you're going to find blood vessels, which I'm going to abbreviate as BVs, and nerves. As well as you're also going to find that's where the yellow marrow is. So that just gives you an idea of some of the major different parts of a long bone. Lastly, this outer layer of a bone is called the periosteum, and the periosteum is typically going to be continuous with connecting ligaments and tendons. So this is just the outermost layer of the bone. It's a fibrous layer called, again, the periosteum. So that's the outermost layer. Okay, so now that we got some of that done with, now we're going to get into the microscopic structure of bone. So now we're going to really look at the individual cells that make up bone tissue. So when we look at bone tissue, it consists of bone cells. And go figure, right? And those bone cells are called osteocytes. Now to break this down again, the word osteo means bone, right? And the word cyte means cell. So literally this means bone cell. And these osteocytes are going to be located in these spaces that we call lacuna. And the reason is that what happens is an osteocyte, okay, here's my osteocyte here. An osteocyte will, in its earlier stages, actually secrete the bony matrix, and so it'll secrete this matrix around it. And what ends up happening is as it secretes this matrix and it completely surrounds itself by that matrix, then it's literally trapped inside this space. And this space here is what we call the lacuna. Okay? So the lacuna is the space, and here in the center of the lacuna will be the osteocyte. Now, Osteocytes are going to have to pass, even once they've trapped themselves inside the space, they're going to have to be able to pass nutrients and gases from each other, right? So that they have to be able to obtain nutrients some way, even though they're trapped in this hard calcium phosphate matrix. So what ends up happening is osteocytes will pass nutrients between each other through these little, so here's another osteocyte here, and here's my, again, matrix around it. And what happens is there's these little spaces in between. So there's little spaces that run in between the lacuna that are called canaliculi. And what happens is you've got little extensions that come off of these osteocytes. I know this is hard to see. I'll do a better drawing of this in just a minute. But these little extensions that come off of the osteocytes, and they'll actually run into those canaliculi. And that's actually how they're going to pass nutrients from one cell to another, or from the blood vessels in the center here. We'll talk about that in just a minute. So, and then again, the intercellular material, inter means between. So the material between the cells is going to consist of collagen, which is going to be this nice tough fiber, and then inorganic salt, especially calcium phosphate. So that's what's going to make up the matrix. So let me kind of draw one of these out for you. And so when we break this down, we're going to talk about these bone-forming units called osteons. Okay? So I'm actually going to draw out an osteon for you. This is a bone-forming unit. And when we look back here for a second, if you look, when we look at a cross-section of bone, bone consists of many of these osteons that kind of run together. So again, here's going to be our osteon, or our bone-forming unit. So if we look here, we're going to have what's called a central canal. And this central canal here, a central canal, or sometimes also referred to as a Haversian canal, same thing, central canal, Haversian canal, is going to contain blood vessels that are running through here. And these blood vessels will actually transport nutrients to and from each of these osteons and the cells in the osteon. Now what you're going to find is that these concentric circles form around that central canal. So this is the central canal here. And these concentric circles are going to contain these lacuna with the osteocytes in the middle. And so here would be, but these osteocytes form these nice little circles right around these blood vessels. So here would be one layer of your osteocytes. And so then you'll find that then there would be another concentric circle and another one and another one, and so on, that would form again another circle of these osteocytes. And I'm drawing again the osteocyte and then the lacuna, the space around it. So again, you can kind of get the idea here that you have these, literally you end up with these circles. If you look here, these circles of osteocytes all around, again, surrounding that central canal. Now remember that these osteocytes, again, in their earlier phases, are going to secrete bony matrix. And that bony matrix is going to fill in, okay, in between here. So this would be all bony matrix. Now the challenge is, again, that you have to be able to bring in nutrients from the blood vessels to these osteocytes. So what happens is you have these little spaces here called canaliculi, and through those spaces are going to be these little extensions that are coming off of the cell. And so those are what's actually called the canaliculi. So this would be your canaliculi. And now nutrients can be brought in from the blood vessels through the canaliculi to this osteocyte. Now, this osteocyte over here needs nutrients as well. So what happens is it also has canaliculi coming off of it, and the canaliculi from this osteocyte will meet up here with the canaliculi from this osteocyte so they can share nutrients that way. So we can share nutrients from this cell to this cell and so on. So that's the importance of the canaliculi. So again, just some terminology here. Again, here's your central canal. Here are your osteocytes that are trapped in those spaces called the lacuna. And then these little web-like connections between them are called the canaliculi. Now, each of these concentric circles here has a name as well. And these are called the lamella. So here would be this circle of osteocytes would be called the lamella. This circle of osteocytes would be called the lamella. So hopefully that helps you out in terms of breaking down some of the terminology here. And you can go back and you can actually see all this drawn in here. It's just a little bit more difficult because it's so small. Okay, so here again we can also zoom in, and here you can see this is a little bit better of a drawing so that it shows you again these osteocytes, and so you can see the osteocyte really takes up most of the space. I made it look like the lacuna, the space was really big, but that space really fits pretty tight around that osteocyte. So here would be your osteocyte, and here you can see those nice canaliculi, again, that are going to connect between the cells. And again, each of these bone-forming units here, this is called an osteon. And so here's an osteon, here's an osteon, and again, in the center of these osteons, we have what are called the central canals. And so those central canals, again, allow blood vessels to run through them. So again, you know, bone is filled with vascular tissue, these blood vessels. Now you can also see that you have what are called perforating canals. And perforating canals actually go in between osteons. And so again, they're blood vessels that are traveling in between these osteons. So that just gives you an idea of what the anatomy of bone looks like here. So now we're going to get into how bone develops and grows, and this becomes very interesting. When you look at bone actually forms by replacing connective tissue inside a fetus, and so when we talk about bone development, we're going to talk about the fact that initially, in a fetus, you have connective tissue, and over time then, as that fetus develops, bone will start to move in and basically form within that connective tissue and replace that connective tissue. So there are two major types of bones that are named after the way in which they develop. So one of them is called intramembranous bones. And so what this means is literally between membranous bones means that the bone forms in between a sheet-like layer of connective tissue. So the bone actually forms within a sheet-like layer of connective tissue, and then eventually will replace that sheet-like connective tissue with bone. So you're going to see this is going to be something that you're going to find mostly in your flat bones, like the bones of your skull. Other bones, and the majority of the bones in the skeleton, are going to form by a process called endochondral formation. And so we call these bones endochondral bones. And what happens is these bones start out as cartilage, as a cartilage model, and then are actually replaced with bone over time. So the cartilage is then replaced with bone. So this is what we see for most of our bones in the body, especially our long bones. So let's take a closer look at this. So our intramembranous bones like I kind of mentioned before here, these are going to be the flat bones of the skull, and they're going to form again as intramembranous bones that develop in these sheet-like layers of connective tissue. And what happens is you have these special cells called osteoblasts. Those are the ones I was telling you that are the earlier cells, the precursor to your osteocytes. And these osteoblasts are going to be the cells that actually deposit the bony tissue. Now what happens is an osteoblast, okay, if here's my osteoblast, will secrete bony matrix. Okay, so it will secrete the calcium phosphate base of your bony matrix. And then what ends up happening is once it completely surrounds itself inside this bony matrix, then we call it an osteocyte. So it's an osteoblast when it's secreting the matrix, and then we call it an osteocyte once it's completely surrounded itself. So again, here you see your flat bones of the skull, and actually you can see here when you talk about when a fetus is developing, you'll see they end up with these what we call soft spots or fontanelles. And so when a baby is born, the skull bones have not, or intramembranous, your intramembranous bones have not fully fused together. And you can actually see that sheet-like connective tissue in between those bones still, and that forms the soft spots or the fontanelles until those bones eventually, again, grow within that that sheet-like fibrous connective tissue and will eventually fuse, and that's when the soft spots close. So again, once your osteoblasts deposit bone and have completely surrounded themselves with that bony matrix, then they're actually called osteocytes, just like we talked about. And the cells of the membranous connective tissue that lie outside of the developing bone will eventually give rise to that outer layer called the periosteum. Okay, so now let's talk about your endochondral bones. So when we talk about your endochondral bones, these are going to be the majority of the bones that are in your skeleton, as we said. And they're going to start out as what we call a hyaline cartilage model, meaning initially you'll see that each of our long bones was just mainly consisted of hyaline cartilage and then was eventually replaced by bone. And we're going to talk about the process by which this occurs. So if you look here, this is endochondral ossification. This is how endochondral ossification happens. And you need to understand just the basic steps in this process. So in step 1 here, you're going to start with a cartilage model. And in step 2 here, so this is hyaline cartilage. This model here is, oops, I'm sorry about that. This is a hyaline cartilage model. That's the type of cartilage, hyaline cartilage. In step 2 here, you're going to see that here, some of the cartilage starts to break down and we start to see the formation of that outer layer of the bone called the periosteum. So again, in this one, we start to see cartilage starts to break down. And we see the formation of the periosteum. Then, here in this next step here, we start to see that blood vessels and osteoblasts that are going to come from the periosteum are going to invade that disintegrating cartilage, that cartilage that's breaking down, and spongy bone starts to form in its place. So we start to see some spongy bone forming in its place. And so we call this initial area where we start to see bone formation in the diaphysis the primary ossification center. So that's where you're going to first see bone starting to replace cartilage, is in this primary ossification center in the diaphysis, in what's going to be the shaft of the bone. Then in this next, so that's where we see our primary ossification center. That's my symbol for primary, is a 1 with a little circle there. So that's primary ossification. Now, if you look in step D here, you're going to see that we now see the secondary ossification centers forming. And these secondary ossification centers are going to be forming in the epiphyses. So again, we start to replace. We're replacing again cartilage with bone here. So those are your secondary ossification centers. Then you'll see an E here. We continue to replace in the secondary and the primary ossification centers. We continue to replace the cartilage with bone. And as that bone grows from the epiphyses closer to the diaphyses and the diaphyses closer to the epiphyses, you'll see that what ends up happening is we're left with these little tiny pieces of cartilage that form these little plates in between the epiphyses and the diaphyses. These are actually called the epiphyseal plates, or the growth plates. And again, these epiphyseal plates or growth plates will close on average in individuals, and again, this is going to vary greatly, and we'll talk about why, but on average in individuals, these epiphyseal plates will close anywhere between 16 and 18. Now, this is going to vary in individuals because the closure of the epiphyseal plates actually depends upon when puberty hits, when hormone levels really take a change. And so those epiphyseal plates are really going to be signaled to close up, or their epiphyseal plates are your growth plates, and they'll be signaled to close up based on changes in hormone. So especially when you see an increase in production of testosterone and estrogen. And so again, as adults, we just see the remnants of these epiphyseal plates, but the epiphyseal plates have been replaced by bone. So that gives you an idea of how these developing bones grow. So now let's talk a little bit about, we talked about bones being active tissue. So we're going to see, we're going to call this the kind of the homeostasis of bone tissue, and this is going to be important to understand because this is going to explain how we actually maintain blood calcium levels. So you're going to see that inside our bone, every year constantly some of our bone is being torn down by these special cells called osteoclasts. So osteoclasts are going to tear down or break down bone. And then our osteoblasts will rebuild that bone throughout our lifespan. So my trick for you in terms of remembering this is you can think of osteoblasts are building cells. Okay? These are your building cells. So osteoblasts are going to build bone. So then you just have to remember that osteoclasts are going to be breaking down bone. And so constantly, osteoclasts are breaking down bone, and then osteoblasts are rebuilding that bone back up. And this happens, again, throughout our lifespan. So on average, about 3 to 5% of your bone calcium is exchanged annually. So what that means is, again, about 3 to 5% of your bone every year is broken down and then rebuilt. And so we're going to talk about why it does this. And so this is why we do this. One of the main reasons is to maintain our blood calcium levels. Now, blood calcium levels are extremely important for a number of reasons. And we're going to get into this as the semester goes on. But just to give you an idea, It's very important for us to maintain a certain amount of calcium in our blood because that is going to be a major player. Calcium is going to be a major player in muscle contraction and in nerve conduction and blood clotting. So again, these are kind of important processes, right? So we need our blood calcium levels to stay stable. So to stay in homeostasis. So we like to have about 9 to 11 milligrams per 100 mil of blood calcium. I don't care that you remember that number, but I do want you to know that we need to keep our blood calcium levels. They need to be maintained. And so again, that's what we call this calcium homeostasis. So what happens is we have these two opposing hormones. And you're going to see, we're going to talk, I have a slide on this later on in the lecture, but I'm going to go ahead and talk about it now. And what happens is if our blood calcium levels rise a little bit too high above our set point here, what happens is the thyroid gland is then going to get a signal to secrete a hormone called calcitonin. And calcitonin is actually going to stimulate the calcium salt deposition in our bone. So it's going to stimulate osteoblast activity here. So what happens then is that, again, osteoblasts will take that calcium out of the blood and store it in the bone. And that will bring blood calcium levels back down to normal. Now, if for some reason our blood calcium levels dip, so it's just like a big seesaw, if our blood calcium levels dip a little bit, we have these things called the parathyroid glands, and they actually sit right behind, there's little bean-shaped glands right here, and they sit right behind the thyroid gland. And they'll actually secrete a hormone called parathyroid hormone. And that parathyroid hormone is actually going to stimulate osteoclast activity to degrade bone and then release calcium. Again, as the bone degrades, we're going to degrade that bony matrix that contains calcium salt, and that will release calcium back into the blood, and so that will help to raise calcium levels back to our set point. So again, I think that this picture right here really helps you out, hint, hint, in terms of the exam, in that this always is hard for students to remember which hormone does which. So if you can picture this seesaw, and if blood calcium levels raise up, calcitonin's on top here, and calcitonin helps to bring blood calcium levels back down, and it does that by stimulating osteoblast activity and stimulating the calcium deposition in bone and bringing us back to normal. And then if you could picture, if blood calcium level dips on the bottom here, parathyroid hormone is released. And that is going to secrete, or that's going to stimulate osteoclast activity that will secrete then that calcium back into the blood, bringing us back up to our calcium set point. So hopefully I like this image because it gives you a visual image of what's happening with calcitonin and parathyroid hormone, and hopefully will help make sense of these opposing hormones, what we call antagonist hormones, and what they do. So that's calcium homeostasis. Now we're going to talk a little bit more about the functions of bone. So again, we kind of mentioned this in the very beginning, and now we're going to get into kind of some of the nitty-gritties on this. So when we look at the functions of bone, obviously one of the main functions of bone, and I don't go into any more detail than this because it's kind of self-explanatory, but obviously it's providing support. So again, your bones provide the framework and support for many other organs and tissues. And it's also going to provide protection. So again, we talked about, especially this is easy to picture in something like the thoracic cage, where you're talking about the ribs providing protection for the lungs, and the sternum provides protection again for the heart. Your vertebra provide protection for your spinal cord. So, and those are examples of how bone provides protection. Obviously, another major function for bone is it's involved with movement. And so, as you're going to see, bones are actually going to act as levers. And when we look at a lever actually has 4 major components. So, one of those components is a rigid bar. And if in this case our example is flexing the forearm here, that rigid bar is actually going to be the bones of the forearm. So this would be the rigid bar. Our second component is going to be the pivot or fulcrum. And in this case, the pivot or fulcrum is going to be the joint. And in this case, it would be the elbow joint. And our third component is going to be an object that is moved against resistance. So in this case, we are moving our hand, right, against resistance, against gravity. So again, as we pull our hand up, that's our object that's being moved against resistance. And then a force that has to supply the energy for this movement. And of course, this force comes in the form of muscles when we're talking about body movements. So here, again, in this case, our force is supplied by the biceps flexor muscle. So again, body movement's another function. Another function of bone is actually going to be blood cell formation. And if you remember, inside a long bone, we have 2 different types or 2 different kinds of marrow. And it says 2 kinds of marrow occupy the medullary cavity. Sorry, this is an error here. Red marrow, if you remember, red marrow actually is going to be found inside your spongy bone. So you remember the spongy bone of your epiphyses? This is going to be found in your spongy bone of your epiphyses, of the epiphyses of your long bones. As well as it's also going to be found in the spongy bone of the skull, the ribs, the sternum, the clavicles, the vertebra, and the pelvis. So again, that's where you're going to find your spongy bone. So again, the spongy bone is found in all of these places, and I should put it, as well as in the epiphyses of your long bones. So it's found in the spongy bone. Your yellow marrow is what's actually going to be found in the medullary cavity. So this is going to be found in the medullary cavity of your long bones. So hopefully that helps. So again, and this is going to be found, again, the medullary cavity, if you remember, is in your diaphysis, the shaft. So hopefully that helps clear up any confusion here. Sorry about that. So again, the red marrow is going to be found in your spongy bone. And your red marrow is actually what functions in the formation of red blood cells, white blood cells, and platelets. So your red marrow actually contains your stem cells to make blood. And this is important because as red blood cells die off, as they do every day, red blood cells are damaged and they die off. We continually make new red blood cells. We continually make new white blood cells as old white blood cells die off. And same with platelets. So this red marrow is very important for, again, functioning in blood cell formation and making that next generation of blood cells. So again, that red marrow is in your spongy bone. Your yellow marrow is going to be in the medullary cavity. So in that medullary cavity, again, remember, lies in the center of, in the middle of your compact bone. And your yellow marrow actually consists mostly of fat. So it's a storage for fat. So those are your 2 types of marrow, and it's your red marrow that acts in the blood cell formation. So bone is also going to function in terms of acting as a storage for your inorganic salt, especially, of course, calcium here. So when we look at, sorry, and I'm not sure why this isn't coming through here, but this should, let's see if it comes through as I push through the slide here. Well, maybe not. There we go. So the inorganic matrix of your bone is going to store inorganic mineral salts in the form of what we especially call calcium phosphate. And that calcium phosphate is what makes up most of your bony matrix. And that calcium inside, that calcium phosphate, is very important because that calcium phosphate acts as a reservoir for the body's calcium. And we just talked about this. When blood levels are low, blood calcium levels are low, our osteoclasts can actually release that calcium from the bone to keep our blood calcium levels to be at their set point. So again, blood calcium levels are extremely important for, like I said, muscle contraction, nerve impulse conduction, blood clotting, and actually many other metabolic processes. So again, and we already talked about this, calcium is stored in the bone under the influence of calcitonin and parathyroid hormone. And real quick, again, I'm just going to show you, I'm going to cruise through this slide here. Just as a review, again, as blood calcium levels rise, you're going to release calcitonin, which is going to stimulate calcium uptake into the bone and osteoblast activity that's going to build that bone. Then, as calcium levels dip, okay, as they fall, parathyroid hormone is going to be released. Parathyroid hormone stimulates osteoclast activity, which is going to break down bone, release calcium, and as it releases calcium into the blood, that's going to bring our calcium levels back up to set point. Just as a reminder. So those, again, are those two major hormones involved with that. Bone is also going to store other salts besides, or other ions besides calcium. So it's going to store magnesium, sodium, potassium, and carbonate ions, which would be important for other metabolic processes. And then, unfortunately, bone can also accumulate some harmful elements, especially lead, radium, and strontium. And so, unfortunately, bone can become a reservoir for some of these harmful toxic elements as well. Okay, so now we're going to get into some of the fun anatomy with bones here, and we're going to talk about the skeletal system, the skeletal organization. So this gets into some of your kind of hardcore anatomy here, and a lot of this becomes just memorization if you haven't been through the bones before. If you have, then hopefully this will just be a nice review. So when we look at the skeletal system, we can break the skeleton down into what we call the axial skeleton and the appendicular skeleton. The axial skeleton is going to be the skull. So here the skull, the vertebra, okay, the sacrum, and the coccyx. It's going to consist of the ribs and then the sternum. The appendicular skeleton is going to be everything else. So the appendicular skeleton is going to be the bones of the upper limb, and then the bones of what's called the pectoral girdle. That's actually going to connect the upper arm to the axial skeleton. And then it also consists of the lower limb and the pelvic girdle. So that's all going to make up the appendicular skeleton. So again, the appendicular skeleton is going to be the upper and lower limbs. Oops. And then it's also going to be the pectoral girdle that attaches the upper limb to the trunk of the body, and the pelvic girdle, which is going to attach the lower limb, again, to the trunk of the body. So again, everything in yellow here is going to be the appendicular skeleton, and everything in red is going to be the axial skeleton. So we're going to start with the axial skeleton first, and then we'll go into the appendicular skeleton. So when we look at the skull is actually made up of 22 bones, believe it or not, fused together. We have 8 cranial bones and 13 facial bones, and then the mandible. So again, we have quite a few bones just in the skull. So let's talk about the bones that make up the skull. When we talk about the cranium actually encloses and protects our brain. And I'm going to come back to these pictures in just a minute here. But the cranium actually encloses and protects the brain and also provides attachment for muscles. And it also contains our air-filled spaces that make up our sinuses. These air-filled spaces, or sinuses as we call them, help to reduce the overall weight of the skeleton. And they actually also help to act as resonance chambers for voice or sound production. So that's the major function of these sinuses that we have inside the bones of the skull. Now, when we talk about the cranium, we actually have 8 bones that make up the cranium. We have 1 frontal bone. We have 2 parietal bones. I'm going to show you these in just a minute. 2 temporal bones. We have 1 sphenoid bone. We have 1 ethmoid bone. And we have 1 occipital bone. So let me show you these. So if we go back, actually I'm going to go ahead here, jump ahead here, and show you on this image because it's a little bit easier to see. So here, obviously, here's your frontal bone. So here's your 1 frontal bone. Now, you have 2 parietal bones that are actually fused in the center here at what we call the sagittal suture. So here would be the sagittal suture. Oops, that's horrible there, but there's your sagittal suture. And you have a parietal bone on this side and a parietal bone on the other side. So you actually have 2 parietal bones. You also have 2 temporal bones on each side. So here's your temporal bone. And then you also have the sphenoid bone that runs all the way across. So this bone runs all the way across to the other side, so that you just have 1 sphenoid bone. And then it's really difficult to see here, and this is where it's really hard. If you look in your book, you'll have a better image of the ethmoid bone. But here, you also have the ethmoid bone that runs, again, across both sides there. The last bone here is the occipital bone in the back here. So there's the occipital bone. So those are your 8 bones now for the skull. We also have the bones that make up the facial skeleton. So these are going to be, we've got 13 immovable facial bones, and then we have 1 mandible. So these 13 immovable facial bones are going to consist of 1 maxilla, and I'll go through these bones here in just a minute as well. 1 palatine bone, which you're not going to be able to see. It's going to make up the hard palate of the roof of your mouth. We have 2 zygomatic bones, one on, oops, I'm sorry about that. Zygomatic bones, 1 on each side. We're going to have 2 lacrimal bones. These are going to be right near your tear ducts. That's why they're called lacrimal. 1 on each side there. And you've got 1 nasal bone. You're going to have 1 bone called the vomer in the middle of your nose here. That helps to make up part of the septum. You're going to have 2 inferior nasal conchae, and we'll talk about those in just a minute. And then you're going to have the ethmoid bone, and as well as the sphenoid bone are going to make up part of the facial skeleton. And then you'll also, the frontal bone will also help to make up part of the facial skeleton. And so that makes up your 13 facial bones. You got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. 13 immovable bones, and then plus you also have then what's called the mandible or the jawbone. So let's go over these facial bones so that you can see these facial bones here. So again, you have the maxilla. So this bone here is going to be your maxilla right here. Here's your maxilla. The palatine bone you can't see, unfortunately. The palatine bone is, if you feel the roof of your mouth, it's going to be, again, the bone that makes up most of what's called the hard palate on the roof of your mouth towards the back. So that's the palatine bone. You have the 2 zygomatic bones. Here's the zygomatic bones in green here. You have the lacrimal bones. So the lacrimal bones are going to be these little blue bones here. You have the nasal bone here. So there's your nasal bone. You have the vomer, which I told you is going to help to make up your septum. So here's the vomer, or I should say down here is your vomer. And that actually it actually ends up meeting up with part of what's called the perpendicular plate of the ethmoid bone. So your vomer actually is down here, excuse me. And then you have the sphenoid bone. And so if you look here, you can see in purple here, you can actually see the sphenoid bone here. That's part of the sphenoid bone. And that sphenoid bone runs all the way across. And then you have what are called the inferior nasal conchae. You have 2 of them, one here and one here in blue. So again, those are part of the bones that make up the face. And then you have the ethmoid bone here in pink. And that's one bone that runs all the way across. And then you have the frontal bone, this big bone here. So those are the bones that are going to make up the face, along with, then you have, of course, the mandible, the lower jaw. So that's called the mandible. Okay. So now we're going to continue on with the axial skeleton. We've done the skull. Now we're going to talk about the vertebral column. And so when we talk about the vertebral column is broken up into your cervical vertebra, your thoracic vertebra, and your lumbar vertebra. And so there's a really easy way to remember how many bones, how many vertebra make up your cervical vertebra, your thoracic, and your lumbar. So you actually have 7 cervical vertebra, 12 thoracic vertebra, and 5 lumbar vertebra. And the easy way to remember this is you can think of, it's kind of like when the time frames that you would eat breakfast, lunch, and dinner. So if you eat a really early dinner, I guess, especially if you have kids, maybe you eat a really early dinner. But so typically, you know, people have breakfast around 7, lunch around noon or 12, and dinner around 5. So that's an easy way to remember cervical, thoracic, and lumbar. So again, cervical are on top, then thoracic in the middle, lumbar towards the bottom. So let's talk about your cervical vertebra first. Again, there are 7 bones that make up the cervical vertebra. These are the smallest of the vertebra. Your lumbar are going to be the largest, and they're going to comprise the neck and support the head. The very first vertebra is going to be called the atlas, and the second vertebra is going to be called the axis. So we'll talk about these in just a minute, and I'll show you a picture of these. And you're going to see the axis has this little tooth-like structure called the dens that sticks up, and it pivots with the atlas. So the atlas actually can move from side to side on the dens. So then when we look at the rest of the cervical vertebrae, we're going to see that they're what we call, they have these bifid spinous processes. And I'll go over this anatomy in just a minute so you can see that the spinous process is going to break into 2. That's what bi means. It's going to split or bifurcate into two parts. And then we're also going to see we have a transverse foramen. The word foramen it literally is going to mean that there's a hole. So I want you to think of the word as foramen as a hole. So again, here's your 7 cervical vertebra here. Here's your 7 cervical vertebra. Here's your 12 thoracic vertebra and your 5 lumbar. So 7, 12, and 5. So here is a picture of, again, your cervical vertebra 1 and your cervical vertebra 2. Cervical vertebra 1 is called the atlas. And if you look at the atlas here, this is kind of cool. This is where it actually is going to articulate with what are called the occipital condyles. You don't have to know that, but it's going to articulate with the skull there. And so the skull can actually move up and down on these big faucets here. And that's actually what allows us to do this motion of shaking our head yes, is between the skull and the atlas. Now the atlas is going to sit on top of the axis. And if you look at the axis is your 2nd cervical vertebra, and it has this big structure that sticks up here called the dens. And so this part of the atlas right here is going to rotate from side to side around the dens. So it sits on top of that and it can rotate. Again, the atlas will rotate from side to side on the dens. So that allows you, that joint between the atlas and the axis allows you to shake your head no. So real quick, I'm going to kind of jump ahead here just so I can show you the rest of the cervical vertebra here. So when we look at a cervical vertebra, okay, again, and just to give you a little anatomy of your vertebra, each vertebra is going to have what's called the body of the vertebra. So again, when you have one vertebra sitting on top of another one with the cartilage in between, that cartilage is going to be in between the body of the vertebra. If you look here, you also are going to have these what we call transverse processes. And in this case here, in your cervical vertebra, you have your transverse processes here. Now, what's cool is your cervical vertebra are the only vertebra to have a transverse foramen or a hole in that transverse process. And that's because blood vessels have to run through there, up from the neck, through the neck into the skull. So we have to be able to bring blood vessels up to the head, and that's why we have those transverse foramen. So there's your transverse foramen, and there's your transverse foramen. If you look here, your thoracic vertebra and your lumbar vertebra do not have any holes in their transverse processes. Only the cervical vertebra have the transverse foramen and the transverse processes. So now you're also going to see that each of these vertebrae has what are called the spinous process coming out the back here. And that spinous process is going to be bifid in your cervical vertebra. That just means that it bifurcates, it splits here. Okay? So that's what we mean when we talk about up here, when we talked about some of the features of your cervical vertebra, being that it has the bifid spinous process and it has a transverse foramen. So you can actually pick up a vertebra, look at it, and tell whether or not it's a cervical or thoracic or lumbar vertebra based on some of these features. So now let's get into the thoracic vertebra. Your thoracic vertebra, you have 12 of them, and your thoracic vertebra are going to articulate with the ribs. So what that means is they're actually going to have 2 extra little articular surfaces, one here and one here. And so here, the thoracic vertebra is going to articulate or join up with the rib tubercle. It's this little bump on the rib. And here, it's going to articulate with the actual head of the rib. So that's one way that you can tell a thoracic vertebra. Another way that you can tell a thoracic vertebra is that it's going to have this long spinous process. And then one of the last ways that you're going to be able to tell is that it's going to be, in terms of size, it'll be kind of in the middle. So your lumbar vertebra are going to be the largest. This one's going to be in the middle. But you'll see again here, you've got your transverse processes with no transverse foramen. Your lumbar vertebra, which I'm sorry, this is not a lumbar vertebra. I'm going to show you a picture of it in just a minute. And I meant to take this off, and I apologize. That's actually a cervical vertebra. If you see, it's got the bifid spinous process. But your lumbar vertebra are your most massive of your vertebra. And so if you look here, this is your lumbar vertebra. If you look here, the spinous process is not going to be quite as long. The spinous process actually, and this picture doesn't do it justice because it doesn't show how it curves down, but the spinous process on your thoracic vertebra is really long. The spinous process here is going to be more wide on your lumbar vertebra. So again, it's more horizontal and broad is that spinous process. So again, just to show you some of the differences between this, remember your cervical vertebrae are going to be small, your thoracic vertebrae are going to be medium-sized, your lumbar vertebrae are going to be your largest. This one has a transverse foramen. So your cervical vertebrae have the transverse foramen here. The thoracic and lumbar do not. And then the spinous process on your cervical vertebra, the spinous process here is going to be bifid. So we have a bifid spinous process. Here we have a long spinous process, and it points down. So again, if you saw a side profile of this, it actually points downward. And it actually makes it kind of interestingly, if you look at a cervical vertebra, if you were actually to take one and look at it from the back, it actually kind of looks like a giraffe. It's hard to see here in this picture, but if you looked at it, it actually looks like a giraffe. And here, the spinous process on the lumbar vertebra is actually going to be more horizontal, so it'll stick out more horizontal. And it's more broad. And because it's more broad and because you have these big articulating processes that stick up from the back, it actually looks like a moose. So here it looks like these would be the horns for the moose. And here would be the moose head. So again, it's hard to see that because you're not able to look at the models of these vertebrae, but if you were to look at them, and actually I think there's some nice pictures in the lab. When you look at them, you'll get to see this, and you'll also look for the giraffe when you're in the lab, in the pictures in the lab. Look for the giraffe here in the thoracic, and then in the lumbar, look for the face of a moose. So hopefully that'll help you out with the lab a little bit. Okay, so those are the breakdown of the vertebra. Now we're going to look just below the vertebral column here. We have the sacrum and the coccyx. So the sacrum is going to be this big triangular structure. Here's your sacrum. This big triangular structure here. And the sacrum, again, is going to be at the base of the vertebral column. And it actually consists of 5 vertebrae that are fused into one bone. So here, 1, 2, 3, 4, 5. Those actually are all fused now as an adult. So that's the sacrum, and then the coccyx. The coccyx is the lowermost portion of the vertebral column, and it's actually made up of 4 fused vertebrae. So here is your coccyx. So you can see here 1, 2, 3, 4 vertebrae that are fused together. So now we're going to talk about the last bit of the exoskeleton, and that's going to be the thoracic cage. And the thoracic cage is going to include the ribs, the thoracic vertebra, the sternum, and the costal cartilage. And so I'm going to show you a picture of this here. So again, here, when you're talking about what makes up a thoracic cage, it's going to be your ribs. Here's all your ribs here. Okay. We talk about the costal cartilage. The costal cartilage is going to be this cartilage that connects the ribs to the next part called the sternum. So here is your sternum. All this is your sternum. And then So those, and then the last part of obviously your thoracic cage is going to be these thoracic vertebrae that are going to be in the back here. So all these thoracic vertebrae that are articulating with the ribs. So that's what makes up your thoracic cage that's going to protect, again, your heart and your lungs. So again, it's going to support, the thoracic cage is also going to help support the pectoral girdle. That's going to hold on to that pectoral girdle is going to attach the upper limbs to the thoracic cage. And it's also going to help function in breathing. And again, it's also going to protect those thoracic and even some of the upper abdominal organs. So it'll even help to protect some of your upper abdominal organs like your liver and your stomach. So now we're going to get into, this is going to be the first slide of the appendicular skeleton. Appendicular. So everything up to this point has been axial skeleton. This is going to be the start of the appendicular skeleton. So the appendicular skeleton is, I'm going to start with the pectoral girdle, and the pectoral girdle actually it makes an incomplete ring that supports the upper limbs. So it's going to be, the pectoral girdle is what attaches your upper limbs to the trunk of the body. And it's made up of scapula and the clavicles on each side. So here you can see, here's your clavicle, okay? And then here, all this is your scapula. So this is what makes up your pectoral girdle. There's the clavicle and the scapula. And again, it's touching that upper limb to the trunk of the body. Let's go over now the bones of the upper limb. So when we look at the bones of the upper limb, we have the humerus. This is the bone that makes your upper arm here. So this is the humerus. Then we have, for the bones that make up the forearm, we have the radius and the ulna. The radius is going to be on the thumb side, and the ulna is going to be on your pinky finger side. And then, okay, we get into the hand. So now when we look at the hand, we have these bones here, the wrist bones. These are called your carpals. And then we have the bones that articulate with the carpals. These are called the metacarpals. I want you to palpate these on yourself. Palpate the carpals and then find your metacarpals. And then you're going to see these bones here are called your phalanges. Okay? You only have 2 phalanges on your thumb, but you have 3 phalanges on the rest of the fingers. Okay, so those are your phalanges. You have your proximal phalanx, which is, again, closer to the trunk of the body, your middle phalanx, and then your distal phalanx, which is farthest away from the trunk of the body. So again, those are the main parts that make up your wrist and your hand. Your carpals make up the wrist, and your metacarpals and your phalanges are making up your hand. Now we're going to get into the lower limbs, and the pelvic girdle is going to consist of your 2 coxal bones, your 2 hip bones, and the sacrum. And that's going to be what's going to support the trunk of the body, or supports the trunk of the body on the lower limbs. So it's going to be what attaches really the lower limbs to the trunk of the body. And the pelvic girdle also is obviously going to help provide some protection for some of your lower abdominal organs and especially your pelvic organs. So some of your reproductive structures. So this just shows you this is an image of your what we call your os coxa, or your coxal bones. And again, you have 1 on each side, and then they connect in the center at the pubic symphysis. So let me show you. Now we're going to look at some of the differences between the male and female pelvic bones, which is really interesting as you get into looking at, and this is where it gets kind of fun if you've ever watched something like the show that's called Bones. I don't know if you guys have watched that show, maybe a little nerdy, but it's an interesting show because they talk about some some real hardcore anatomy in there. And one of the ways that they're able to, identify when they come upon a body, because the show was centered around a forensic anthropologist. So one of the ways that they're actually able to identify male versus female in a body is very easy if they actually find the hip bones or the pelvic girdle. And when you look at the differences between the pelvic girdle between a female, this is a female, and a male here, it becomes very, very obvious. Now, obviously, the differences in the pelvic girdle of a female versus a male are mainly because a female's pelvis is built, whether you want it to or not, it's built for childbearing. And so if you're going to look at the differences here, one of the first things that you're going to see is that the female pelvis is much wider. If you look at the pelvic brim and the pelvic inlet here, you're going to see that this is a much wider hole in females than it is in males. So this is called, this top area right here is called the pelvic brim. And that pelvic brim is going to be much wider. Okay. Another thing that you're going to notice here is this is called the pubic arch. And if you look at that pubic arch, lo and behold, it is also much wider in the female than it is in the male. So that pubic arch is actually greater than 90 degrees in the female and closer to 90 degrees, actually less than 90 degrees in the male. So those are two quick, easy differences. Another way that you can notice if you're looking at the pelvis all put together, if you look at in the back here, the sacrum is actually tilted back in females, or tilted posteriorly in females, to make this, again, inlet here wider to be able to accommodate childbirth. And that coccyx bone actually is more movable in females than it is in males. And if you look at the os coxa itself here, the os coxa bones are actually wider. These are called, again, or coxal bones, are actually wider here. And here in the males, they're more narrow and taller. So if you look, the top of what we call the iliac crest here is usually a little bit higher in males. And in females, it's a little bit lower because, again, these bones are wider. So again, those are some of the major differences between male and female pelvis. So hopefully now you can see the difference, and it's pretty obvious that this is a female and this is a male. There's other differences in a female versus a male skeleton as well. You can actually look at the skull. Female skulls are smaller. They're typically lighter, a little bit more rounded in the facial area. Usually females have smaller jaws, and we didn't talk about the mastoid process, but they have, if you want to look it up, they have a less prominent mastoid process. Obviously, you don't have to know that since we didn't cover mastoid process, but those are some of the major differences that you can see in a female skull versus a male skull. Again, we talked about the differences in the pelvis, so that pelvic cavity is wider and shorter, roomier to be able to accommodate childbirth. In the pelvic girdle, the female hip bones are typically lighter and thinner. The sacrum, we talked about this, the female sacrum actually usually is tipped back or bent posteriorly. And it says bent more sharply posterior. It's actually tilted. A better word would be that it's tilted back in females. This is a little bit confusing. It just means that it's bent in males, but it's actually, I'm going to kind of cross that out to make this easier. I think an easier way to put this is that that the sacrum, because it's talking about the sacral curvature, the sacrum is tilted posteriorly in females. So I'm just going to make that, I think, a little bit easier than talking about the sacral curvature. So again, that sacrum is tilted back or posteriorly in females. And then the coccyx, again, bone, when you look at the female coccyx, it's actually more movable than it is in males. So hopefully that all makes sense. So now we're going to look at the lower limbs. And so if we look here, the bones of the lower limbs, we're going to start with the femur. So again, this would be your femur that makes up your upper thigh bone. And then we have the tibia that would make up basically the shin bone that you can palpate. And then here's your fibula. Your fibula you really can't palpate because it's covered by muscle tissue. But if you want to feel your fibula, if you feel this outer part of your ankle bone that juts out here, it's actually not part of your ankle, it's actually part of your fibula. And you can actually feel this part right here called the lateral malleolus. So if you feel that right on the outside, that big bump on your ankle, that's your lateral malleolus, that's part of your fibula. And then if you go towards the inside of your ankle, you can actually feel that big bump on the inside, that's the medial malleolus, and that's part of your tibia. And then when you look at your foot here, again, you have your ankle bones that are called your tarsals. So these are all your tarsals. Here's your metatarsals that are going to articulate with those tarsals. And then you have your phalanges. So again, we call your fingers phalanges. We also call your toes phalanges as well. So here, if you look, now be very careful because on your foot, again, we've got tarsals and metatarsals. It's on your hand and wrist that we have carpals and metacarpals. So be careful with those different terms because they're so alike. And then again, you're going to look here and you're going to see for your phalanges, just like on your hand, here you have 2 phalanges that make up your big toe, and then you have 3 on all the other toes, 3 phalanges here. Okay, so we're going to get into this very last bit of the lecture that has to do with your joints now. And so now we're going to talk about the joints or articulations. I've been using this word articulate. Again, that's where one bone meets up with another bone. So your joints are the functional junctions between bones. And your joints are going to enable, obviously, a wide variety of body movements, as, again, those bones can move past each other. Joints can be classified according to the degree of movement that is possible in that joint. So believe it or not, we're going to talk about some joints where that joint is immovable. Some joints are slightly movable, and some joints are freely movable. And we'll talk about these joints when we talk about synovial joints. So now we're going to talk about the different types of joints, and we'll talk about which joints are immovable, which ones are slightly movable, and which ones are freely movable. So when we classify joints for this class, or for the purposes of this class, we're actually going to classify the joints according to the type of tissue that makes up that joint, or the type of tissue that binds that joint together. So we're going to actually go through these different types of joints. I'll give you examples of these different types of joints, and then we'll talk about one specific type of joint, some of the movements associated with that. So the first joint that we're going to talk about is called a fibrous joint. Fibrous joints are called fibrous joints because they're held together with this dense, really dense fibrous connective tissue. And so these joints, because that connective tissue is really fibrous and dense, these joints are not movable. They're immovable joints. So a good example of this would be the sutures of the skull. So again, in between, the frontal bone and the parietal bones, where those bones meet up, you have just a little tiny bit of dense connective tissue that's there, and so that joint is not movable. Or you have a few fibrous joints, or some fibrous joints that are just slightly movable. So you actually have a joint between the distal tibia and fibula. And so actually I'll go up and I'm going to show you this real quick since we just covered a picture of this. Let me go back here for just a second. Sometimes my PowerPoint gets a little hung up here. So this would be the joint that we're talking about right down here. This is actually going to be a fibrous joint. And so there's actually a little bit of dense connective tissue right here, again, holding those two bones together. So those are examples of fibrous joints. Sorry, it'll take just a second here for my PowerPoint to get caught up here. Okay. So again, and this is a picture of that fibrous joint. So you can see this is actually the joint between the parietal bone here and the temporal bone here. And you can see there's that dense fibrous connective tissue. So then we also have cartilaginous joints, and these joints are going to consist of hyaline cartilage or these discs of this more dense cartilage called fibrocartilage. And fibrocartilage is something that you could find like in between the vertebra. So that would be the cartilage that you find in between the vertebra. So again, that's an example of a cartilaginous joint would be the intervertebral discs, the discs between the vertebra that help to absorb shock. And so these joints are just slightly movable. Other examples of cartilaginous joints are going to include the symphysis pubis and the first rib of the sternum. And the symphysis pubis is, I'm gonna actually jet out of this lecture here for just a second, and I'm going to show you the symphysis pubis because, let's see if it'll let me do it here. Because I think it's hard to picture the symphysis pubis without going through. So just so that I don't skip over that, what I'm going to do is I'm going to scroll up here for you and show you the symphysis pubis. Okay, here we go. So if we look at this slide here, this is actually the symphysis pubis here and here. That's the symphysis pubis. So let me go back here into that PowerPoint. And actually, let me jump ahead here so we don't have to go back. But I wanted you to see, and that symphysis pubis, it's important to know what that is because obviously, again, that there's cartilage there, and that's what allows a little bit of stretching of that cartilage allows this pelvic inlet or pelvic cavity to widen during childbirth. So again, there's just a piece of cartilage there that makes up that pubic symphysis. So let me go back down here and we'll catch back up, but I just wanted to show that to you real quick. Catch back up on our lecture here. So here we go, and I'm just going to have to reset really quick my pen here so that I can still draw for you here in red. Okay, so again, those are some examples, and you should know the examples that I give. Make sure that you know those as examples of these different types of joints, because typically if I give an exam question, it'll be multiple choice, and I'll give a description of a cartilaginous joint, and you'll have to pick out one of those, which joint would be an example of a cartilaginous joint. So again, I give you some examples of the major cartilaginous joints. And then we also have these joints called synovial joints. And this is the majority of the joints, honestly, in our skeleton. Most of the joints are synovial joints. And these are much more complex than our fibrous or cartilaginous joints. So now we're going to get into what makes up a synovial joint. And these synovial joints are going to be freely movable joints. So when we look at a synovial joint, the ends of each bone that are involved in a synovial joint are going to be covered with a little bit of hyaline cartilage. We oftentimes call this articular cartilage, and that articular cartilage is just a name for the cartilage on the bones that are going to articulate with each other, but it's made of hyaline cartilage. And then let's jump ahead here. So when we look at a synovial joint is going to consist of, make sure I didn't skip a page there. So a synovial joint is going to consist of a joint capsule as well. So we've got the articular cartilage on each end, and then we have a joint capsule. And you're going to see this is going to consist of an outer layer of this dense connective tissue that joins the periosteum, and an inner layer that makes up the synovial membrane. Now that synovial membrane is what's going to secrete the synovial fluid. And that synovial fluid has the consistency of about egg whites and helps to lubricate those articulating surfaces. So especially within that joint. I'm supposed to say within the joint there. So this is an example of what your synovial joint cavity would look like. So again, here you would have, your synovial membrane that would secrete synovial fluid into the synovial joint. And here are the two bones that are articulating with each other, and you can see covering the surface of each of these bones is this articular cartilage. So that's what's making up the basic structure for your synovial joint. So much easier when you can see a picture of this. Again, you have the articular cartilage on each bone, then you have the synovial membrane that secretes the synovial fluid. Some synovial joints actually contain these shock-absorbing pads called menisci, or you may have heard the singular term for that is meniscus. So you have your menisci in your knee. And then some synovial joints will also have these fluid-filled sacs to help in shock absorption called bursa. So I'm going to show you, this is a more complicated synovial joint. So if you look here in red, you can see there's the synovial membrane that would secrete the synovial fluid. So here and here would be, all in here would be the synovial fluid. Here you can see, here's the, in blue here, would be the articular cartilage. That's going to cover the femur here, and here would be the articular cartilage that's covering the tibia here. And then here, if you look, these little pads of cartilage are the menisci, or each individual one. That's a meniscus, and that's a meniscus. And then on top of it, you're going to see, if you look here, you're going to have these little fluid-filled sacs here called bursa. So here's a bursa, and here's a bursa. So again, hopefully that helps you to visualize the different parts of a synovial joint. So now, based on the shapes of their parts and the movement that they allow, synovial joints can be classified in these different ways. So we have the so again, now what we're going to do is we're going to take, because synovial joints make up the majority of the joints of the body, we're actually going to break down the different types of synovial joints because there's so many synovial joints. So we have what's called a ball and socket synovial joint, and a ball and socket synovial joint is going to be something like you would see in your hip and your shoulder. It literally sounds just like it is described. You'd have a ball of one end fitting in the socket of another end of a bone. So, and I'm going to show you pictures of these joints in just a minute. You also have what's called a condyloid joint. A condyloid joint is going to be where you have an oval-shaped condyle of one bone that's going to articulate with an elliptical cavity of another. And a good example of this would be between the metacarpals and the phalanges. You're going to find these condyloid joints. You also have gliding joints, and these are easy to picture. Gliding joint is named after the fact that you have these two flat surfaces. So the bones, the two bones that are articulating with each other are almost nearly flat. So the joints of the wrist and the ankle, so basically again the joints between your carpals and the joints between your tarsals are going to be gliding joints. And then also it's easy to picture the joints between your vertebrae because the vertebrae are flat. Again, the bodies of the vertebrae are flat. So those are actually gliding joints as well. Then we have a hinge joint, and the hinge joint in your body is going to be the elbow joint. This is going to be where you have the convex surface of one bone is articulating with a concave surface of another, and I'll show you a picture of this in a minute here. And then you also have your pivot joints. So you're going to have kind of the cylindrical surface of one bone is going to articulate with a ring of bone or a ligament. And the easiest pivot joint to picture is the one where you have the proximal end of your radius and your ulna. And I'll show you again a picture of this in just a minute. And then the last one is a saddle joint. And literally you have the surface of one bone kind of fits in the saddle of another. So that's why it's named after that. And so the saddle joint that you're going to see inside the human body would be between the trapezium carpal and the proximal metacarpal of the thumb. So it's between the metacarpal of the thumb and the carpal that it articulates with. So let me just show you some examples of this. So this is a nice drawing of a hinge joint. So you can really see that convex surface of the one is going to articulate with this concave surface of the other bone. So again, the elbow bone is a perfect example of a hinge joint. So here you can see again, this would be that concave surface of one. The pivot joint, again, the pivot joint that you can see would be between the radius and the ulna, and then you also see one between the tibia and fibula. And this is a better picture of what your pivot joint is going to look like. Here's your ball and socket. And then here's your condyloid joint. Again, your condyloid joint was one that I told you would see in between the metacarpals and the phalanges. So again, you can see here's your, you'll see it between your metacarpals here, or I'm sorry, your metacarpals are down here, and your carpals here, and then your metacarpals and your phalanges. So when you look at this joint, and it shows you there's a number of different areas that you can see it, but one of the, I think the easiest places to see it is between the metacarpal. So sorry, here's your metacarpal right here, and then here would be your phalange down here. So this right here would be a good condyloid joint. And then you have the gliding joint. The gliding joint is easiest to see. You can see it's a flat surface there. The gliding joints are easiest to see between, one tarsal and another tarsal, or between your carpals. So if you looked between this carpal and between this carpal here, there's going to be a flat surface, and that would be an example of a gliding joint. And then your saddle joint, the example of your saddle joint that you're going to see in the body is going to be between your metacarpal and your thumb, and then between your carpal that it articulates with, called the trapezium. Okay, so now we're going to get into some joint movements. When a muscle contracts, its fiber is going to pull its movable end, which would be called the insertion, towards its stationary end, called the origin. And this causes, again, movement around a joint. So when we talk about origin insertion for muscles, the origin is going to be the bone that's not moving, and the insertion is going to be when you contract that muscle, the bone that actually does move. So that's what origin and insertion means. So now let's talk about some different types of movement. So these are your different types of movement, and it may be easiest if you look through some of these and you actually do these movements yourself. But if you look here, the first type of movement that we have is flexion and extension. So what I want you to do is I want you to take your hands and put them out in front of you, and then I want you to bring your forearms, your radius and your ulna, closer towards your humerus. That's flexion. That would be called flexion of the forearm. And flexion happens when you decrease the angle between two bones. So again, if you're flexing your forearm, as you bring that forearm up, okay, you're decreasing the angle between the radius and the ulna and then the humerus. That's flexion. Now as you move your hands away from your body, okay, and do the opposite motion, now you're extending your arms. So that's flexion and extension. Dorsiflexion is going to be a special term that we're going to use for when you actually pull your foot up So when you pull your foot up, that's called dorsiflexion. And I don't know what happened to my A in here, but then when you push your, or point your foot down, so now point your foot, point your toes, that's plantar flexion. And the easy way to remember this is plantar flexion, you're using your toe to point at the plants on the ground. Okay, so that's plantar flexion. You're pointing your toes towards the plants on the ground. Okay? And then dorsiflexion is just the opposite. And then hyperextension is if you're ever pushing your, if you're extending a part of your body past anatomical position. So if you were to stand in anatomical position and you were to pull your hands towards you, that's flexion. If you extend your hands back to anatomical position, that's extension. And then if you were to pull your hands back past anatomical position, that would be hyperextension. Okay? Abduction and adduction is typically used with your limbs in comparison to the trunk of your body. So if you were to take your arms and you were to pull them away from your trunk of your body, that's abduction. And if you were to take your arms and pull them back towards the body, that's adduction or adduction. So you can think abduction is if you're abducting or pulling a limb away from the body, and adduction is if you're adding that limb back to the body. Rotation, okay, and circumduction, you can see these in your book, is where, again, if you're doing something like you're rotating your hands, okay, or although rotating your hands is not a good example because we're going to talk about, we use pronation, supination with hands, or you're rotating your arms at the shoulder joint. Okay, that would be an example of rotation. And then pronation and supination are going to be terms that we'll use with, especially with your hands. So I want you to take your hands and stick them out in front of you. And if you picture your hands holding a bowl of soup, that's supination. Now, you should be looking at the palms of your hands, okay? Like if you were holding a bowl of soup, that's supination. Now, if you were to rotate your hands so that now you're looking at the palms of your hands, that's pronation. So supination is if you're going to be turning your hands like you're holding a bowl of soup. Pronation would be if you're turning your hands so that you're looking at the back sides of your hands. That would be pronation. Inversion and eversion is used with your feet. So inversion would be if you were to take your feet and have them pointing forward. Now if you were to roll your foot inwards, that would be an inversion. And now if you were to roll your foot out, that would be eversion. Okay? So protraction and retraction is actually used with your jaw. So if you were to take your jaw and jut it out, stick it out, and you can hear me do that here, that would be protraction, and then retraction is if you bring it back in. So if you were to jut your jaw out, that's protraction, and if you were to bring it back in, that's retraction. And then elevation and depression, again, is just like it sounds. If you were to take your jaw and move it down, that would be depression. And if you were to take your jaw and bring it up, that's elevation. So you can actually look at in your book, there's a figure, I believe it's figure 7.39, but double check, you can double check in your book. There's a nice figure that shows you all of these movements. And my suggestion for you to really learn these movements would be to actually go through these movements and do them yourself. Do these movements so that you get a good understanding of what these different movements are. So that concludes our lecture for today. And if you have any questions, again, remember that you can always send a question on the discussion board, or you can email me directly.